up to now you have explained that we have a basic roadmap for optimal nutrition. The simple basic idea of optimal nutrition, whole foods, plant-based diet. Do the nutrition guidelines promote or reflect what we should do to have optimal health?
No. The nutritional guidelines in the United States, I'm quite familiar with those guidelines because those guidelines are recommended by expert panels of scientists. Mm-hmm. And I have been on many of those panels myself. I have given testimony to our U.S. Congress. So I've been I've been in newspapers and television and so forth. I know this very well. The guidelines, the so-called dietary guidelines, are very much conflicted by industry. The industry, for example, the dairy industry, the meat industry, the egg industry, those industries really have a very strong influence on who is going to be on those committees. And they also have a very strong influence, even if the committees are quite good. The final statement is made by the secretary or the minister of health. So they'll change it. They'll actually reframe the recommendation according to what's acceptable to industry. So the dietary guidelines are, in my view, almost useless. They're not very serious.
So many people go with them. So they try to focus on what these guidelines say. So what would you say to those people, apart from that we have the weight of the evidence showing us that,
right.
You know.
Well, let me give you an example. Just the guidelines are produced in this country every 5 years. Mm-hmm. And the most recent one was this year. No, I'm sorry, it was last year. Yeah, the most recent one was last year.
They came out in March of 2016, I think. They were a bit late this year.
That's right, they came late. Mm-hmm. So, yeah, sometimes they're late. Yeah. Well, in any case, the process is the committee makes a report, and then it's open for public discussion, as you may know. Mm-hmm. And after for public discussion, then the Minister of Agriculture, the Secretary of Agriculture, and his staff decide what they want to say. Mm-hmm. And as I said before, they usually change the recommendations of the committee somewhat. In this case, the committee, which was the committee was not a very objective committee. It was biased already. But in any case, the committee made a statement this year was maybe a little better. But when they were talking about the question on diet and heart disease, they said, for example, let's review the data on diet and heart disease. And they talked about this. Mm-hmm. They never put in that report the single most important study of all, Dr. Cole Esselstyn. They made no reference to that. And Dr. Esselstyn had a new report out just in 2014 that shows that there are 177 patients. Yeah. When he gave them some advice, actually it was 196 patients, he gave them advice over 5 hours, just 5 hours. He said, okay, here's what you do. All these patients had heart disease. All of them had heart disease, 196. Then he goes back some years later and he asks him, he says, what are you doing? Are you still doing that? And 177 said yes. That's 89%. 89% of those patients said, yes, we're still doing it. Then he asked, well, have you had any heart attacks? Only one person out of the 177 had a heart attack. Yeah. Only one person. The ones who did not follow his advice, well, so the heart recurrence was less than 1%.
Yes. Amazing.
Less than 1%.
Yeah.
The ones who actually chose not to listen, 62% had a heart attack. Yeah. Less than 1% versus 62%. And the Dietary Guidelines Committee did not put that study in their report. So I wrote my comments. Mm-hmm. And my comments became somewhat public because our U.S. Congress, they have a blog, it's a published blog. They published my comments in their blog. But even though my comments, I said, you're not doing it right. You're not being responsible. You know, it was published. but still the Secretary of Agriculture wants to pay no attention. They just want to ignore it.
Amazing.
So we have a really serious problem, and I would suggest in most Western countries. I just lectured recently in Europe, in Italy, Slovakia, Hungary, Poland, Belgium. I spoke to the European Union Parliament in Brussels, and also to Portugal and Spain. I've spoken to many European countries. And, the situation, and I think it's true, I'm sorry, we didn't make Greece, but the situation in Europe is very similar to us here in the United States. Very similar. One difference. In Europe, you have mostly a single payer system. In other words, you have free health care, more or less. So the government is in charge of the health.
Yes.
Okay? In our country, it's mostly the industry is in charge of the health. So you compare the two countries, Europe, U.S. The cost of health care in the United States is more than 2 times, almost 3 times higher than the cost per capita cost in Europe. That's per person.
Yeah.
Much higher here than in Europe. And when you rate the United States in terms of quality of health care, we are in last place. You have better health in Europe.
Yeah.
You spend less money. So the governments in Europe take more interest, and that's been my experience. When I go to countries in Europe, sometimes I get to meet with the Minister of Health, or for example, in the European Parliament, I go in and speak to the European Parliament. In our country, the government has a very difficult time accepting this kind of thing because they're tied to industry. On the other hand, I must say, when you go to the population at large, I see the two populations. I think there's more, the population is becoming more interested in this idea in the United States than in Europe. The individuals in Europe, the citizens, of course, there's people like you and maybe your friends, but there's not as many citizens actually following this advice. Whereas in the United States, there's more citizens, less government. We don't have, governments are not doing it in Europe to more attention. So we need to have a combination of the two. Your kind of government and our kind of citizens to pay attention.
Yeah.
Because this is a worldwide problem.
Yes.
So I don't particularly care whether it's the United States or Belgium or Greece or England. It's all the same. Because the food affects all of us the same way.
Yeah. I hope next time you come to Europe, you can come to speak to Greece as well.
Yes. Okay. Thank you very much.